today's program. Look, importantly, I have Ella and Sarah with me. Ella, would you like to start and just tell us a bit of your story? I've heard quite a bit of it through the news, and it's been pretty well covered, but please tell me your story, then we'll bounce over to Sarah.
Absolutely. So currently I'm the Secretary of the Nurses Professional Association of Queensland, but I am a registered nurse. So I've been a registered nurse for 7 years now, and I worked for Queensland Health about 2.5 years ago now this month. The mandates were implemented in Queensland, and I was stood down from my job, and I've been stood down without pay for 2.5 years, and in January this year I received my termination letter, even though the mandates had dropped in September in Queensland. And I was 6 months pregnant at the time. I'm 8 months pregnant now. I'm 2 weeks out from having a baby. I was on approved maternity leave from Queensland Health as well, so that was a bit of a shock, as I thought once they approved that maybe I'd be safe for a little bit and then be able to go back to work eventually. So that's where I'm at now. It's definitely been a bit of a shock for me. You always know it's on the cards, but when you finally get that letter, it's, it definitely hits you. And I'm sort of stuck because I don't know many people would be wanting to hire a nurse at 8 months pregnant. So the future of my nursing career is definitely a big question mark.
Wouldn't it be against the law to terminate somebody while they're on maternity leave?
Look, we're looking into that, but ultimately they're saying that it's got nothing to do with the maternity leave. They were going to fire me anyway. So they do say...
Did the letter describe you as gross misconduct, or what did they say?
Yeah, it was serious misconduct and insubordination. So they can't say now that it's because you didn't get vaccinated. They say it's all semantics. So they say that it's because you didn't follow a reasonable direction. And after I got my I received 3 threat of termination letters over the 2 years, and I felt like they didn't really even take my responses into account. But on the last one, I said to them, oh, well, wouldn't it be more beneficial for you to keep me in the system? I've got 35 years of nursing ahead of me. And maybe another penalty, like a financial penalty where you dock me a pay point like they did for the education department, and they just said no. So they weren't willing to negotiate at all.
What about you, Sarah?
Hi, well, yeah, I'm actually in Victoria, and I'm an associate here with the Nurses Professional Association of Victoria. So I deal with a lot of our nursing members, and we are hearing some, I suppose, horrific stories coming through our system in that many workers are being overworked. The workloads are increasing extensively. We have inexperienced staff handling situations without some, experienced staff being able there to watch over them and ensure that mistakes aren't being made. So it's raising significant safety issues in our hospitals. And I mean, these are only a handful of concerns that we see. We're seeing situations where members are saying that, in the ED, for example, there's not enough experienced staff in there, and nurses and that sort of people are handing out medication without it having secondary checked by senior staff. So this nursing shortage around the country is causing major issues in our health system.
So you're not a nurse yourself.
No. I actually deal with a lot of case management through the nurses. So I deal with a lot of our nursing members, hear a lot of the stories that are happening throughout our membership.
And it's still mandated in Victoria that you have to have 3 jabs, I think, by
3 COVID jabs and a flu jab to work as a nurse.
Right.
And because of that, and the requirement still to wear the PPE gear, we're seeing a lot of our experienced nurses who just cannot handle, sending that extended period of time in PPE gear. So they've chosen to retire and leave the industry early, leaving inexperienced young nurses without supervision. We're hearing of RNs in their first couple of years being nuns on units in the hospitals because they don't have experienced staff. So this is where our healthcare system is headed if we don't get some of these nurses back.
Ella, what led you in the first place not to behave?
Behave, yes. So at the time, we worked through most of the pandemic. So we'd already heard quite a bit about COVID. Queensland was one of the last states to actually get any COVID. And I had friends who lived down south who'd been infected with the Delta strain, and they're my age, so they all fared pretty well. But I sort of had a lot of other big things going on in my life at the time, and this sort of fell to the back and then sort of reared its ugly head suddenly. I wasn't dead against getting vaccinated initially. I didn't want the mRNA ones. Novavax was still waiting to be approved in Australia, so I was open to getting Novavax. But by the time that was available, I already had received disciplinary letters. I'd been stood down. I'd seen that, a lot of people were still getting sick and that the vaccines weren't really working. So I thought, oh, why would I go and do that now? And I don't even know if I want to go back to this workplace at this point in time. So that's why I decided not to.
Did you have any support from your colleagues through that process?
I would say that nearly 50% of the nurses on my ward didn't want to get vaccinated. We were given only a 2 or 3 weeks notice that we had to have our first jab by the end of September in 2021. And most of my ward had not received any of their COVID jabs by that point, even though they'd been available for a few months. Many of them had said that they weren't going to do it, but one by one, they just started getting them. And by the end, I was the only one left standing. Unfortunately, I think the fact that there were people who had really genuine concerns about the safety of the vaccines, and it was just horrible watching them go through it, because I was at that point not married, I don't have any kids, I didn't have a mortgage, so I really just had to look after myself. And my family were very supportive and said, look, if you ever needed to move back home, you could do that. And it's really terrible for people who didn't have those options or that support. I don't know what I would have done. I think I would have, looked at other employment, but for people who had huge responsibilities, it was a really big question for them. But yeah, I would say that there were a lot of people, and nurses who, one of the other reasons I didn't get it is I was working with a number of nurses who'd had different vaccines. So some of them had AstraZeneca and Pfizer, and they all had different reactions. So I'd seen, I was working with a girl who was not much older than me, who on a night shift, she was saying she felt really, really unwell and found out she had a pulmonary embolism. And that was, not long after getting AstraZeneca. And so seeing all of those things, people were definitely talking about it on the ward. People were over the mask situation. We were wearing masks and we had no cases of COVID, or if we had one in northern Queensland. So people were asking questions, but it was just too scary to have to stand up to it. And I think they saw, my nursing manager was beautiful. She was so supportive. She said to me she didn't understand how I could throw my career away, but she knew I wouldn't be doing it just for the sake of it. She was really tried to help me.
Sarah, do you have many contact with nurses who are leaving because of the mandate issue, or you don't have contact with them?
I know I do. We deal with a lot of nurses. I know at the very start of this, there was we were sort of told, dribbled through channels, that there was only, in one particular hospital here, there was only 3 nurses who had supposedly, done the wrong thing and put everyone's health at risk and not gone along with what they should have done. And yet I knew personally that I was meeting with nurses through NPAV and NPAQ to try to assist them through this. And I was meeting with 300 or 400 nurses that were saying they wouldn't do it. They realised that it went against basically everything they'd been taught, that there was so many red flags, that the concerns they were seeing with people that were being vaccinated and the outcomes of that were terrifying. And these nurses there was a nurse of 35 years experience, a midwife, and she had a mortgage, she had children, and she had to stand up because of her health. She said, I can't, I need to, I'd rather lose my home than my life. So that was, these are the stories that we hear constantly off the nurses. But the ones that were in the system still, that did choose to take it for whatever choice that they made, that certainly wasn't the feedback that they were receiving. They were receiving that there was only a handful that had said no, and that this was, these people were dangerous and they shouldn't be nurses anyway if they weren't complying. So, but that certainly wasn't what we were dealing with on the street when hundreds of nurses were coming to us.
Hundreds.
Asking for assistance.
Oh, hundreds, absolutely.
Hundreds.
How many in Queensland, Ella?
So we've obviously not all of them are members with us. We NPAQ's been around for nearly 10 years, but when the mandates all hit, we had a huge influx of membership for people turning, because none of the Labor affiliated unions helped any of their members with this situation. But we did a right to information request from Queensland Health, and we estimate there's about 3,000 staff missing from Queensland Health. So they've admitted at this point in time to 1,250 staff being terminated, but nearly 1,000 resigned because of this issue. But they didn't take into account contracts that were not renewed, and we know that many people are on contracts. It's a very female heavy workforce and lots of women on maternity leave, and that gets backfilled through contracts. So they didn't count those casual positions that were just dropped, people who decided to retire. And then interestingly, like people who were on their own self-funded leave, they said, oh, they're not required to comply with the mandate, but here am I on my own maternity leave being terminated. And there were so many people on work cover, long service leave, annual leave, sick leave. They were all terminated, and they're still terminating them. So we had one come through last week. She got terminated on the eve of International Women's Day, after our health minister's been in the news every few days saying, oh, we welcome you back. There's no barriers. These people, women primarily, could be sent a letter saying, we need you back. They can still even say, you've been very naughty, but we need you back. But instead, they're still terminating them at this point in time.
That's amazing.
Yeah, it's nonsensical. And why would people bother to reapply for jobs when people who already have the job are still being fired? But unbelievably, we've still got so many nurses who do want to go back. And something I've been working on in the last couple of months was these surveys I sent out to try and streamline this process. So I've got surveys open in Queensland, Victoria, New South Wales and South Australia. And because they were all, other than Queensland, still mandated. And we had about 400 entries for the return to work survey in Queensland. I imagine there are more than that, but after 2 years of being constantly knocked back, people are pretty deflated. So I was pretty amazed to get 400 entries to that survey, and sent it off. And she just did.
Let me ask, have you had contact with the health minister in regard to what you've just put to me?
Oh, yes. So I invited her. I had a rally last weekend. It was a bit of a circus up here, actually. So we had the Supreme Court decision about the QAS and the QPS, and then that ended up getting a lot of media attention and asking if it meant much for our members. I had already invited the health minister to a rally that I was having outside Gold Coast University Hospital for these healthcare workers who want to go back. It's not about the vaccine. We don't even need to talk about the vaccine anymore. And it is possible at this point in time, even if we don't agree with that standpoint, for people to be pro people returning to work and pro people getting vaccinated when it was necessary. Ultimately, what we're facing now is a very unsafe healthcare system across all of Australia, but in Queensland, it's really alarming. And so I invited the health minister and said, in the spirit of all the comments you've been making in the media of supporting these workers going back to work, I'd love you to either attend the rally or publicly endorse it. And she ignored ignored the invitation. Then I sent her the list with the permission of all the people on it. It has their contact details, how many years experience they have, where they've worked, where they would like to work. I've given them all the information they need. And these are healthcare workers who are willing to work anywhere around Queensland. So she could literally cherry pick them, and her job's been made easier. And anyway, I sent that, and then the media covered the rally, and the health minister denied getting an invitation. She said it wasn't in their inbox. but they ended up finding it magically, and I got a response afterwards. And in the media that day, she's committed to contacting all of the healthcare workers on that list individually, and that they would be managed by the Director General. Well, I also had requested that they cease disciplinary action of these people who were still employed and get them to go back to work. And anyway, she wrote me a letter, and it just said, we'll be continuing disciplinary action on a case-by-case basis. So definitely didn't say that they would stop doing that, and basically directed me to the Queensland careers page and Smart Jobs, because all these healthcare workers who've had jobs previously obviously don't know how to apply for a job. And we'd had many of them on that list actually applying for jobs since the mandate dropped and being turned away because of the disciplinary action. So that's why it hit the media so hard, is because it was absolutely contradicting what she was saying publicly. But she still hasn't made any effort, and we know it's in her power to do it, to just expedite this process and take these people back. But then, so her idea of individually case managing these people is all of these people on this list got a generic email that didn't even address them by name, saying, we hear you've got skills that might be beneficial for Queensland Health. Go to Queensland Careers page or Smart Jobs. And my heart broke, because everyone was so excited when she said she was going to reach out to them individually. Obviously, you still hold your breath a bit, but she'd said it publicly. Why wouldn't she try and help get them back? And it was just so insulting for these people who've had up to 40 years experience. It's rare to find somebody who's actually got less than 10 years experience on this list.
Yeah.
So for her to not help that, like, they were just absolutely devastated. And especially, you know, the big hype around International Women's Day and, you know, being there for women. I gave the health minister all of the stats on how this primarily affects women, this decision for the healthcare sector. And it's been very disappointing, but I guess not surprising.
It's terrible. Sarah, I've lost you, so I don't know whether I need some technical help here, but can you still hear Sarah? No. Well,
I don't think she's still here.
I don't think she's still here. Well, look, I'd like to thank you both so much for coming on today. I wish you all the best in the next 2 weeks.